This is a conversation with Stephen Porges. Hi, Stephen.
Hi, Serge.
So you have paid a lot of attention to the nervous system?
Yes. Through my whole life, I've been doing research on how neuroregulation of what we call physiological state and behavior, how that's related to how we interact socially. It's actually been a real curiosity that I had when I was quite young, because as everyone, we always are interested in how we regulate our behavioral states in the presence of others. So that interest has been really prevalent in my life in thinking about it. And it's only been during the last, I'd say last 20 years or so, that I realized that was a core issue in many aspects of mental health and quality of life issues.
Yeah. So it's not just an individual pursuit of understanding how to regulate yourself. Yeah.
Well, it actually becomes, you start off with the individual pursuit, and then it somehow blends into your, if you're a scientist, it kind of blends into your research questions. So it starts off by saying what types of physiological changes are more related to being able to process information more efficiently. And then when you start developing those skills and you start thinking about those processes, you give up the issues, or you subjugate the questions regarding cognition, and you start asking about bodily feelings, and you start asking about emotions, and basically can you regulate in the presence of others, or what is it that makes you functionally feel better? Mm-hmm. So it's kind of an interesting dialectic about how nervous system interplays with our feelings, or visceral feelings.
Yeah. So how our nervous system interplays with our visceral feelings. So how does it?
Well, you see, this is a very good question, but people interested in body psychotherapy live in that world, because most of clinical psychology and psychiatry is really a top-down model, which doesn't even allow anxiety to really live in your viscera. Fortunately, there are people like the body psychotherapists who have a real understanding of and intuition regarding the importance of sensory information coming from the body, going up and affecting how we respond to the world, and vice versa, how our perspective of the world, our perceptions, and our reactions to various features in the environment change our viscera. So this interactive notion is extremely, it's an intuitive notion, but unfortunately much of clinical medicine and much of clinical psychiatry has really neglected a real respect for the bidirectionality of the viscera and the brain on the viscera.
Yeah, so that sense of bidirectionality, not just feelings don't happen by themselves in some kind of a ethereal sphere, and there's a bidirectionality.
Absolutely, and what you start thinking about is really as I said earlier, I think the subjugation of feelings to thoughts. And even when we go back to the real important work by Descartes, where he starts talking about mind-body dualism, and he talks about, in French, je pense, donc je suis, and of course your French is much better than mine, but is that I think, therefore I am. He does not use the phrase j'aime sens, donc je suis. And yes. My pronunciation is horrible, but using the reflexive form of the word feel, it's really how your body is feeling, your visceral feelings. That's not part of the equation. But can you imagine if that's what Descartes had really said, where we would be today, yes, in terms of the developmental trajectory of what it is to be a human? And what we've done is really said to be a good human is we really have to depress or reject or subjugate visceral feelings to enable our good brain, our smart brain to work. And of course, the consequences of this is really they end up in many of your clients have these features where they're not respecting their body's own responses and not even aware of it at times.
So it might make sense to actually spend a little moment talking about how a visceral feeling connects, happens, what the experience of it is. Because in a way there is a problem even with the expression of visceral feelings. It's as if, when that expression could almost connote the fact that it's a feeling that happens in the viscera, therefore disconnected from the rest of the body and the nervous system.
Well, it's really quite. I'm actually writing on this now. I'm thinking about this because what I was really working on is this whole notion of what it is to be safe. And this becomes a critical issue, is that we actually live within a paradoxical perspective of safety. We think we know, and we think by using the word know that safety is defined by our cognitions and can be structured by cognitive skill sets, meaning words. We can define what safety is. Yet, safety is really our body's response to the environment. And we basically are working very hard to forget that body's responses. So if we think about children in classroom environments, some children are very unsafe in that physical environment and have great difficulties in learning. But because some individuals are safe, we impose upon everyone the fact that if some are safe and can function, everyone should. And so our society really functions on the notion that if you have the individual difference of being highly reactive or viscerally responsive, you should turn that off. That's bad. So rather than investigating and understanding this, in many ways celebrating some of the unique sensitivities that people have, we basically say it's bad. And this bleeds over into the world that you and many of your colleagues work in, and that is the world of trauma. Because in the world of trauma, people's bodies respond. And it responds in ways, once they respond following trauma, they often are totally different people. They can't relate or interact in the same world. And they're often made to feel, whether it's feeling within society or even within clinical sessions, that the way they are responding now is bad. They actually get an evaluation that their behavior isn't good. And in evaluating their behavior, it puts them further and further into defensive strategies.
So I want to slow it down a little bit because there's so much information in what you're giving. And a part about, for instance, taking kids at school and having a pre-imposed model that's almost a mechanical model of functioning like machines. If one machine functions a certain way, then all such machines are going to have to be expected to have the same behavior, and therefore, a Procrustean bed about what is the right level of activation or response. Which is ignoring the way actually that these are responses of an individual organism to its environment.
Yes. Another way, even to, in a sense, re-emphasize what you very succinctly described, we treat children in schools as if they're learning machines. And the success of schools really is defined by what information we're able to program into that machine. We don't respect the fact that perhaps the skill set of learning how to regulate your visceral state, your bodily state, being able to be social, being able to know when you can't deal with things or when you're overwhelmed so you can develop strategies to cope, those aren't part of the curriculum. It becomes quite evident when you start working or doing research with very challenged individuals like autistic children. And interestingly, with autistic children, the basic treatment model or the educational model is a special education model, and that tends to be basically more learning, and more learning, without building into the model that the real problem with autism, as well as with many other clinical disorders, is the ability to be calm and to viscerally regulate in the presence of others. So what they're doing is forcing people to be in context of situations that make learning and other behaviors very inefficient.
Yes, and what therapists do these days are very careful to realize that clients cannot change unless they're in a regulated state. So we take children and try to force feed them when they haven't learned the basic of regulation.
Or their nervous system hasn't developed well enough to be able to be regulated. So we try to use, again, laws of learning, and we try to up the motivation, whether it's through punishment or reward, to change the behavior when perhaps the system isn't developed enough or is atypical. And so those strategies are basically inefficient. To basically put it into another metaphor, and this is a metaphor that I use in my talks, I talk about an underlying visceral state as coloring our reaction to the world. So I put a slide up of a traffic light, which has a green, yellow, and red lights, and they're representing different physiological states. And I put a common physical stimulus out in the environment, and you get a response on the other side. But based upon whether the individual is in a state that supports safety, which would be a green light, the response will be different than if he's in a state that reflects danger, which would be yellow, or life threat, which would be red. So the same physical stimulus in the environment could produce three different responses in different individuals, or even in the same individual, based upon the physiological state.
Yes. So as you describe this interaction between cognitive processes, reactions, and the ability to regulate our emotions and our reaction to fear, it feels that you're giving actually a great example of what you said earlier about how that's a different conception of what it's like to be human.
Yes, and it's basically saying what are our goals? What are the goals of our institutions? Are the goals of our institutions to enable people to merely walk around with more information, or are goals to make people be able to literally interact and reciprocally regulate each other to feel good? So this goes back to this, what Descartes said, and we basically have followed this track of more thinking, more cognition, quote, smarter people. But in that level of smartness, we've become literally ignorant about what our bodies really need to feel good.
Mm-hmm. And maybe we talk about what our bodies need to feel good. Maybe we can talk a little more about that mechanism of how the visceral reaction works, how that circuit is between the viscera, the nervous system, because in a way, a lot of the time that people talk about, being in their body, or there's almost a mystical, a metaphysical quality to the body versus thought. And I think as you describe the process itself, there is a sense of that bottom-up quality.
Well, being in the body is or attunement, or whatever terms that people like to use today, they're intuitions. What I'd like to say is that the goal of society, or the goal of humanity, is to be able to immobilize without fear. And you're going to find that a very strange metaphor, but if you think about it, it's really part of your goals of your therapies. You don't want people to be, quote, tightly wrapped, anxious, and defensive, and you want them to be able to sit down and be embraced and be hugged and to hug others, to conform physically and to be reciprocal in the relationships. And if people are, in a sense, tightly wrapped with a high motor tone, high sympathetic nervous system state, they're conveying to another person a defensiveness. And whether we call this anxiety or not is really what license you have on your wall. But basically, if you're tightly wrapped in under sympathetic stimulation and the muscles are prepared to move, you're not going to be quote. You're conveying cues to the other person that you're not really safe to be close to. And so we're dealing with very interesting dyadic issues about, when we use the term being in the body and also being near another person. And this may be a good time to kind of emphasize some of these neural circuits. First of all, the autonomic nervous system is extraordinarily important in conveying information about our viscera to our brain. The vagus, which is really the world I literally live in, has about 80% of its fibers are sensory, so it's conveying a lot of information, and it's bringing this up to an area in the brainstem. It doesn't have the same neural specificity as someone pinching you on the back where you can localize, or some touching something in your fingertips where you have great localization. These visceral feelings have great there's a diffuseness to them, so the actual labeling becomes difficult. But the motor parts of the autonomic nervous system are very interesting in terms of what they regulate. Most individuals learn that we have two branches of the autonomic nervous system, a branch that is really a mobilization or a defensive one, which is a sympathetic nervous system associated with fight-flight behaviors, and another branch called the parasympathetic nervous system, of which the vagus is the primary, which is often associated with growth, health, and restoration. While that simple metaphor of paired antagonism is a useful one, it's really not totally accurate when describing how our body reacts to challenges. And it's this misunderstanding that actually led me into developing the polyvagal theory, because the polyvagal theory actually articulates two defensive systems. A defensive system of fight-flight, which everyone is familiar with, which is sympathetic and adrenal-related, but also another defensive system, which is an immobilization, shutting down, often passing out, dissociating, a system that is really a life threat system. And we, of course, can see this in mice when a cat picks up the mouse and they immobilize and they look dead. Mm-hmm. So we actually have a vagal system, which is a defense system. And this was literally written out of the literature because people wanted to have a nice, simple paired antagonism model. And sitting above this system, both those systems, is a newer, uniquely mammalian myelinate vagus, which is linked to the muscles of the face and head, so that when people are smiling and when they're happy and when their voice has good prosody or intonation, and they're able to focus and hear human voice, the myelinate vagus is actually calming us down and efficiently processing our cardiovascular needs and our metabolic needs. It's sitting on top of the sympathetics, turning them off.
Yeah, so the vagus, or the two parts of the vagus nerve, are in fact on the one hand the most ancient and also the most recent parts of our evolution.
Yeah, of vertebrate evolution, yes.
Exactly. Yeah. And the fight-flight is in between.
Yeah, right. And the fight-flight, of course, the way I like to view it is that mammals, when they evolved, had to succeed, since they needed to have interaction for nursing and for other forms of social needs. They needed to be able to turn off these defensive systems, but they need to know when to turn them off. And again, this becomes the issue in our society. When do we turn off our defenses? When are we safe to be in the arms of another? When are we safe to go to work? When are we safe to go to sleep? So your clients will often have issues about they're not safe with other people, they can't be hugged, they have sleeping disorders, they have gut disorders. All these things are autonomic features that happen when this newer myelinated vagal system isn't serving as this major regulator of those older systems.
Yeah. So really understanding better our heritage, our apparatus, in order to be able to use it for effective regulation.
Right. And what I'm starting to focus on is, if we want to know the clues of the vulnerabilities of humans in terms of their health and physical and mental health, is we need to, in a sense, focus on the neural structures that changed from the phylogenetic transition from reptiles to mammals. And it's really interesting if you start doing that. You start seeing that in that transition, one of the most important things is this myelinated vagus and the lack of dependence on a immobilization defense system. So if we think about turtles, or of course our common ancestor with reptiles is not a snake or a lizard, it's actually an ancient tortoise. And if we start thinking about what is that, the primary defensive systems of the large tortoise, it's immobilization. Mm-hmm. And when we start thinking about what's happening to traumatized individuals, well, many of them will have experienced that immobilization response.
Yeah.
So we need to, in a sense, demystify the responses and understand them as being very ancient, and then understanding what happens when we actually use ancient responses. It's often very difficult to become what we were before, so we actually may have reorganized.
Yes, so we're really talking about the fact that in a way, the stronger the stress, the more we tend to regress to a very archaic form of survival.
Yeah, and we can actually shift or even modify the word from strength of the stressor to basically saying reduction of options of dealing with the stressor. Mm-hmm. So that if we could flee or fight, we're going to do that. We're going to use the sympathetics. But if we're locked in a room or being held down, we have very few options. And we're going to then go automatically, not through any volitional behavior, but we'll be triggered into these older circuits. I'll give you an example. I was watching a CNN clip, and they were showing a plane that was having great difficulty in landing. The wings were tipping up, and it was kind of looked really, really precarious. And it landed safely, and the reporter went to interview the passengers, and I'm sure the reporter had a great expectation that the person that he would interview would say that this was very scary and I was ready to jump out of my skin. So he goes up to a woman, and he says, "How did you feel during this landing?" And she said, "Feel? I passed out." Mm-hmm. Okay, so but she wasn't not everyone passed out. Some people were functionally, jumping out of their skin. Mm-hmm. But her nervous system interpreted this inability to fight or to flee as a life threat and shut her down, just like the mouse in the jaws of a cat.
Yeah.
And you can start seeing the adaptive function of that is, one, is going to raise pain thresholds, and two, if you're going to die because you're now mildly hypoxic, you're not going to feel anything.
Yeah.
And then if you survive, hopefully you'll be fine, or at least alive. And so the real issue, of course, is to kind of respect these things that our body does automatically, and not to be angry at our bodies.
Mm-hmm. Mm-hmm. Yeah. So again, we're coming back to, in a way, what it's like to be human. And to have that embodied experience.
Right. And part of the embodied experience becomes very critical to humans and to many, many other mammals, because the requirement of being interactive with other humans is critical for their survival. Because when they're born, they need nursing, and someone has to take care of them, and similar things happen when they're very old. But the issue is humans require other humans to interact. And there's a term that used to be used within the, I think it's been used within the psychiatric community, which is something called symbiotic regulation. Mm-hmm. And I think we have to go back and really redefine that, because what it really is sending cues to the other person's nervous system, so that person sends cues back to you that this is safe to go into the arms of the other.
And you have paid attention to that in terms of the mechanism in which we have evolved love and attachment.
Yeah, but I think there's some really other interesting examples. So when you deal with HIV subjects or patients, you find out that their caregivers tend to get very angry with them and feel unloved. You feel the same thing, or you get the same information when you talk to parents of autistic children. The parents feel unloved by the child. And what they're really saying is that in both cases, the facial expressivity of the child is limited. The child and the HIV patient, they're not making eye gaze, they're not using facial expressivity, and their voice isn't conveying any prosodic features or intonation. So they're basically become more machine-like in their behaviors, and the caregivers and the parents feel disengaged. They feel insulted. Their body is responding. And so an important aspect of therapy is really not to merely deal with the patient, but also to deal with the dyad dealing with the patient. So the parents or the caregivers need to understand that their interpretation of the behavior is the natural physiological response. However, they can't attribute motivation to the behavior. And this creates, like teachers in schools, where kids disengage by turning away, they'll get just angry and they'll start being abusive to the kids.
Yeah. So we can override our unfiltered reactions.
We can attempt to override it. They're very hard.
Yeah.
And I've actually, in some of the workshops that I've run, I've actually created a little experiment where what I call the reluctant therapist, where I have the therapist turning away while the client's talking. And so as people go through these role playing, and they almost get to situations where they want to hit each other. Or I should say the client gets so upset, and then you reverse it. It's really quite an amazing thing how easily our bodies change state when people disengage us, when we engage them.
Yes. So that's the powerful part is that even knowing it, even in a role play situation, it has such a hold on us that we really cannot so easily disengage from it.
Yeah, it's quite amazing. And of course, in your practices where you may be dealing with couples, or let's say one of the couple has a trauma history, which will in a sense result in often gaze averting or losing ability to regulate state. What's the other person's response to this? It's basically just really angry.
Yeah. So as I'm listening to you, there's something that feels very nice about deconstructing that mechanism of what happens in an interaction, and a sense of that part of that search results in a way of helping not take these things personally, helping removing the area of blame, helping removing the layers of interpretation that are a block to people functioning effectively with others.
Yeah, I totally agree. I think we live in a world that places the term I use is a moral veneer over people's behavior. So it tries to interpret it as being motivated. And I use when I give talks to clinicians, I always say, well, when your boss or your chairman doesn't look at you when you talk to them, you feel bad. And then I realize that most clinicians don't work for anyone. And they don't work for anyone because those types of behaviors bother them. But if you're in an academic world, administrators tend not to have the best social skills. But I'm really trying to say that the social skills are not learned skills. They're much more biologically emergent. So there are people who make good eye contact, who have curiosity, facial expressivity. They have this reciprocity in the interaction. And what they're doing is throwing cues at the other person to make that other person feel safe. And when those cues work, the other person starts throwing reciprocal cues back. So the face starts becoming, you would see it as more alive, more expressive. The intonation would be greater. The physical distance between people might be reduced. These are all the things that I'm sure you see within your clinical practices.
That we do, and when we're in the middle of a clinical practice, we really pay attention to it, and we're very aware of it, but of course, as we react as human beings, we have just as much difficulty as everybody else paying attention to it.
Yeah. My test has always been that when being a father and understanding that you react to your kids when they start throwing things at you, or you react to your students when you're a mentor. And when I say throwing things, I don't mean throwing physically, but throwing cues. And you have to really step back and say, what if they haven't eaten? What if they haven't slept? What if they have all these other things going on? Their ability to recruit functionally the neural circuit that supports safety and social interaction is going to be very challenged. So their ability to be engaging, expressive, and understanding is going to be very limited. And we can flip this in terms of the whole culture that we live in, which is really a culture that says you can't do enough, you can't work hard enough, you can't accumulate enough, and everything is evaluative. So the culture is really saying, you're in a dangerous place. And I always wonder, what would humanity be like if we were more respectful for the needs of humanity to have safe environments?
Yeah. So two things. One is that question of what if we actually were paying attention to safety as opposed to, accumulating or also judgment in terms of, being evaluated in terms of accumulation. But also what you're saying is that the way out, the shift out, is not so much an intellectual shift or an emotional shift about simply paying attention to safety, but is changing into a different system, voluntarily fostering the ability to shift into the social engagement system.
Yeah, well, again, if we are smart, and this is where science can be helpful, we can start learning what are the features in the environment that functionally trigger our nervous system into fight, flight, or allow us to move into a safe and recruit this social engagement system, and what are the features that shut us down. And often things like background noises, a lot of clinical practices are in office buildings with low-frequency ventilation on it, or they're near elevators, or like I heard a little bit earlier, I think a siren went by in your place.
I'm in New York City.
Right. And you might have heard on my side the elevated train, the L in Chicago went by. Now these are producing physical cues to our nervous system to be basically vigilant and to anticipate potential danger. So we're in a sense bombarding our nervous system with a lot of these features. And a smart environment would really get the information out of there so that our nervous system wouldn't have to be hypervigilant for predator or for danger, but can now functionally relax, engage, and get all the benefits of a social interaction.
Yeah. Paying attention to all of these things that put us in a hypervigilant mode.
Yeah, I've actually started thinking about like even the issue of mindfulness meditation, and realized that if you wanted to do any of those exercises, you need truly to be in a safe environment, because your breath and your attentiveness would be distracted, would be different if there's any degree of hypervigilance. And I realized that even the metaphor of evaluation, or non-judgment, which is part of meditation, is really, if we use the word evaluation and we map it into the polyvagal theory, evaluation is really the same thing as saying we're in a dangerous environment. And
scanning the environment for danger, paying attention to where to run.
Yeah. And so when we, in a sense, are making our kids study and attend or focus, we're basically recruiting hypervigilance states that are modified to be focused, but are certainly not healthy states.
Yes. So we're coming back to that sense of safety for the kids, but for the grown-up, for everybody, as you mentioned, the sense that, it doesn't make sense to really think about mindfulness or pursue mindfulness per se without really actually paying attention to how we tend to be reacting to a lack of safety. So the awareness of what it is that makes us feel unsafe, the awareness of facing it, the dealing with it, is really a prerequisite for finding mindfulness.
Right, and the flip side is a prerequisite to know what are the features that enable you to feel safe, that turn off these defensiveness. And that, to me, is really what becomes exciting in the future of clinical treatments. That if we were, in a sense, more understanding of the necessary features in the environment that turn off the defensive systems, then clinical practices or clinical treatments could be more efficient, and so life would be a lot better. And so there are a lot of features that are important, including getting rid of the low-frequency noises in the environment, reducing the unpredictability of environments, and basically having having someone that you feel safe with.
And so we're, in a way, evolving toward treating underlying causes as opposed to treating symptoms.
I actually think that the primary core And so if we take this notion that we have different neural circuits that evolve with different profoundly important adaptive functions, so there's no emergent behavior that is functionally bad. All the behaviors have adaptiveness, except some of the adaptive features of some behaviors are contradictory for social behavior and for social interaction. Mm-hmm. And the goal of therapy is, of course, to enable people, I hope, to make people, enable them to regulate their visceral state and to engage in others and to enjoy the interactions with others. And that requires that newest mammalian circuit. But that circuit is only available if we can downregulate our reactions or our systems that evolve for defense.
Mm-hmm, mm-hmm. So we're no longer talking in terms of traditional pathologies, but we're talking about things that have, in a way, are good reactions to possibly bad perceptions, or basically regulating the way we function.
Yeah, and actually, I tend not to like the word perception because that involves a degree of awareness and, a very cognitive process. Mm-hmm. We respond to things in ways that, like a polygraph. Our body is responding to people and places. It's just now our job to be literally to read our own printout. We have to know that when we feel uncomfortable, there's a reason our body is feeling uncomfortable. And we need to, in a sense, adapt and adjust to that.
Yeah, except to play devil's advocate, I would, argue with the sense of reading the information, because there again, that would be a cognitive process.
Yeah, no, you're absolutely right. It's a conundrum, isn't it?
Yes, it's hard to talk about processes without having these images.
Yeah. So what I think we could kind of slide out of that one by merely saying, at least we want to respect our body's reactions.
Yes.
And rather than continually try to develop a skill set that rejects whatever our body is telling us. Mm-hmm. Then we kind of respect it. And the other term I like to use is that when we respect it, we then kind of use our awareness and our voluntary behavior to navigate into places where we would feel more comfortable. So we can kind of create a partnership between the respect for our bodily feelings with our stewardship of our body through our cognitive functions.
Yeah, I mean, that language for me, as I hear you, evokes a visual of gentle waves as opposed to jagged movement.
Yeah. So, I mean, when we're all younger, we can deal with like noisy places like bars or crowded rooms and places. But as we get older, sometimes when we're in those crowded places, our body starts to functionally fail us, and we want to get out of there. And a lot of people don't really, in a sense, respect those reactions until it's too late, until they can no longer control their behavior in those settings.
Yeah. So we have, in a way, a lot of our pathologies come from too great an ability to override those signals.
Yeah, we're getting the signals. We're just saying we're not respecting them. So because the society, I think this has a lot to do with culture, and it goes back to my kind of introductory comments on Descartes, which was this subjugation of bodily feelings to cognitive functions. And also, if we go back to even issues regarding religion and the notion of Western religion being very much involved in dispelling the importance of bodily feelings because they became part of the animal, while cognitions were merely on our way to becoming spiritual or becoming away from the body.
Mm-hmm. Yeah, so we get to that sense of the conception of who we are from a bottom-up perspective.
It's a bottom-up and a top-down. We want to keep everything moving because part of our brain is regulating our viscera, and the viscera is providing information. What's also extremely important is a lot of our, it's the simple thing like posture. When we shift our posture or lean back, we're actually sending different information up our blood pressure receptors, our baroreceptors to our brain. So when we lean back, we tend to get a little, more relaxed, less aware. But if we move to an upright position, we trigger a different change in blood pressure that makes us alert and focused. And we become functionally two different types of people. I have this wonderful chair that is called the Perfect Chair. It's a zero gravity reclining one. And I go into that, and I don't want to get out of it. And I feel totally lethargic. I don't want to do any work or write. Nothing's interesting to me. I just want to be there. But when I go up to my office and sit in my desk, I'm in the upright thing, and I say, well, this is interesting. This is fun. I love doing this. But I'm a different person. What I'm saying is when I'm in that recline mode, I can't even get myself motivated to get out of it.
Yeah.
So it's a simple little shift in posture does amazing things to how we react to the world, how we organize our thoughts, and how we motivate ourselves.
Yes, but and what's interesting there is it's a shift in posture, but it's also a shift in the dyad between, say, me and the environment, because it's not, in the example you described, it's me, the posture, and the chair I'm in.
Well, actually, you're onto something, and another way of viewing it, is you're shifting from being focused on smooth muscle to being to recruiting striated muscle. Because when you sit up, you're increasing the muscle tone. You're recruiting different circuits, and when you're in that zero gravity bit, your muscle tone is quite relaxed, and you really become literally a smooth muscle organism. Which has a different agenda.
Right.
It has an agenda of conservation of resource, of restoration. But when you're in the upright and you get the skeletal muscles working, you're now in a interactive, engaging organism.
So in a philosophical way, you think of the individual, the self, as a process, and under certain circumstances, the process becomes oriented toward being a smooth, relaxed.
And when you get into those moods and those states and those physiological processes are occurring, there are probably some wonderful things happening in terms of health and growth and restoration, and even in terms of ideas and thoughts. But you're not a very social organism when you're like that.
No. Yeah. So we're in a way just talking about the way in which we can be different selves. We can and these cells form as a reaction to, as an adaptation to as a response to the environment of the moment. And yeah, go ahead.
Well, I was going to say that we think of the term, I like to use terms like there are different neural platforms upon which different emergent adaptive behaviors can occur. So when I'm in the zero gravity perfect chair, it's not that my behavior is maladaptive. It's just, but it would be viewed as being maladaptive if I had a group of friends over for the evening. Okay, so the context is really defining what is appropriately adaptive, but the behavior is, each of the behaviors are adaptive if they're in the appropriate context for those behaviors. And what we end up seeing is that pathology is really defined by an adaptive response, or I should say a response that would be adaptive in one setting is now being elicited in a setting where it's now maladaptive. And so trauma victims who may be dissociating or shutting down, this may have been extraordinarily adaptive during the traumatic event, but it's maladaptive during in a social setting.
Yes. So, it's a sense of changing the definition of pathology to what is a reaction that is adaptive to the current circumstances or not.
Yeah, I totally agree with that. And I think once we do that, there's no such thing as bad behavior. There's just behavior that doesn't fit the context. And then we take away some of the moral labels that have really affected people.
Yeah, and it's in a context. I mean, definitely very, very important, very powerful. That taking away that stigma, taking away the judgment, taking away the moral context, and judgment evaluation in a way puts us in a mode of danger,
defense.
Yes.
So,
and in contrast. Sorry, go ahead.
I was going to say you're really getting it and getting you've distilled the whole process, because once we're there, we can no longer, once we're in the state of evaluation and defensiveness, we can't engage those other circuits that are objective in actually trying to work with the client.
Mm-hmm. And in contrast, this is a view that is about, just understanding that these are processes that have a certain inherent flow, and redirecting, learning, in a way working with that potential that we have to learn and adapt.
Yeah, well, you brought up one important point, and I probably should bring this up before we close, and that is, even though we have those three circuits, we can modify the two defensive circuits through the use of this newer mammalian social engagement system, so that we can mobilize without being in fight and flight. We call that play. But what does play have that's different than the defensiveness of fight or flight? Well, play has face-to-face social referencing. It's using that social engagement system to signal that the intentionality of the movements are not going to be dangerous. And you can see this if you watch dogs play with each other. They'll chase each other, they'll do a little bite, and then they'll make a face-to-face, and then they'll reverse the roll. The other one will chase. And if we watch people when they play sports, if they hit someone, the other person, if they make good eye contact and they apologize, there's never any aggressive act. Mm-hmm. But if they hit someone and they walk away, someone's going to chase them, and there's really aggression. Likewise, the immobilization circuit gets co-opted by the social engagement circuit, and we call this foreplay. So when people are, or loving behaviors, there's face-to-face and there's immobilization, where people are learning over time or experiencing over time the ability to be immobilized in the arms of the other. And I keep emphasizing this because for mammals, immobilization is really a potential for something very bad to happen to them. So mammals always move unless they can feel safe with another.
Yeah, so we're talking about the good immobilization.
Yeah, right. Yeah, and this is often recruited by the immobilization response is interacting with, to become, in a sense, a positive immobilization response. It's interacting with neuropeptides like oxytocin, which actually are targeting areas in the brainstem like the source nucleus that regulates that old unmyelinate vagus, so that it enables us, in this case women, to give birth without, in a sense, going into syncope or passing out or dying. Mm-hmm. It enables people to, cuddle and hug without problems, and it enables women to breastfeed without having to move. They can immobilize. Mm-hmm. So there's a real interesting issue of how we've used old structures that evolved for defense and how we've changed them or co-opted them for play behaviors, fun behaviors, and for reproductive and sexual behaviors.
Yeah, great. So that's a nice way. That's a context in which we have, in that large context, what we do in therapy is, in a way, part of that is continuing that ability to adapt these structures.
Yep. Yeah. To enable your clients to have more and more flexibility in the world.
Yes. Thanks, Steve. This recording is part of the Somatic Mindfulness and Relational Psychotherapy podcast. See the website relationalimplicit.com.
Old structures that evolved for defense and how we've changed them or co-opted them for play behaviors, fun behaviors, and for reproductive and sexual behaviors.
Yeah, great. So that's a nice way. That's a context in which we have, in that large context, what we do in therapy is, in a way, part of that is continuing that ability to adapt these structures.
Yep. Yeah. To enable your clients to have more and more flexibility in the world.
Yes. Thanks, Steve.
This recording is part of the Proactive Mindfulness podcast. We explore how to be more present and engaged in our lives and how to make lasting change. This is a contemporary take on mindfulness, informed by embodied therapy and the Polyvagal theory. You can find more articles and videos on the website proactivemindfulness.com.